The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Community Talk Radio. This is Project Independence and You on LIU Public Radio. I'm Kristina Liu, usually your producer, but today I'm playing host, and I'm here with my co-host Otto Lohse. And we are speaking with the fabulous Nicole Christensen, who is the president, founder of Patient Advocacy and Care Coordination. She's an author from Crisis to Calm. She is our guru of all things advocacy. And thank you so much for being back on our show, Nicole, and welcome.
Thank you so much for having me. I love the opportunity to speak about advocacy and to speak with you guys in particular. So thank you.
Great, absolutely. So I will dig in. I know Otto, before we started the show, said he has a long list of questions. So we'll flip it over to Otto. Otto, what is the first question you want to give?
I've been, as Kristina knows, I'm always pushing people to not be shy when you talk to your doctor. And people in my generation, a lot of them are quite shy about talking to the doctor. The doctor is the doctor, so, it's up to him. Well, not really.
No, you're absolutely right.
It doesn't work like that, really. Maybe, Nicole, you could give us an update on your background. How did you get involved with this advocacy situation, and why do you believe it's important?
All right. Well, thank you. There's so many reasons it's important, but I'll tell you my personal why. I founded Care Answered 10 years ago, so it's our 10-year anniversary, which I'm excited to say. It's a good milestone. I started in patient advocacy and advocacy for senior citizens 25 years ago in Washington, D.C. And there, unfortunately, some of the things I was advocating on a direct level and policy level are still things that we as patients are dealing with today. So it's so important to empower yourself, as you were saying, Otto, to be your best advocate, to not be afraid to ask questions. The real thing is, we might have heard that buzzword, patient-centered care. That's a real thing. But you as a patient have to make sure it's patient-centered. So doctors are very knowledgeable. They went to school for a long time. They're generally very smart people. But we as patients are experts in ourselves, or we as patients, the caregiver, loved one, are a better expert in the person we're caring for than the clinician. So without that information, without that questioning, they can't do as good of a job as they might want to do. So I totally agree with you. I actually, unfortunately, I lost my brother at the age of 38 from a preventable medical error. So that was my first start. And this is when I was younger, before I started patient advocacy or advocacy for seniors or any patients. He was born with a heart condition. And so he's very prone to pneumonia. And this was known. He went to the same clinicians, and he came in and he says, I think I have pneumonia. And his clinician said, nope, you don't have pneumonia. And we're concerned that you're struggling with depression. So I'm the youngest of 6. Again, I always say that like I had anything to do with it, but we have a strong, strong family. And so we were rallying around him, and he got a call. My dad got a call. We lived in Eastern Long Island, and my brother lived in Manhattan. And my dad got a call. My dad, drove like crazy fast to get to my brother in Manhattan. And he died in my father's arms. And he died of pneumonia. They never checked the scans. So these are the things, and I would love to say that my family and my situation is an anomaly, but it isn't. So we have to speak up. And my brother did, right? He said, I think I have pneumonia. But to your point, Otto, the doctor's like, nope. And it's a doctor that you've seen. So what do we do? And so that was my first step into the desire for patient advocacy, but my father had a similar situation. And that left him, again, a preventable medical error that left him in diminished capacity for the rest of his life until he passed away. So these things are happening to all of us and to our loved ones. And there's so many of us, most of us are caregivers, as we know many of us know the quote from the late Rosalind Carter, right? There's only 4 kinds of people: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers, right? So it really touches all of us. And so it's just so important. And so with Care Answered, our mission is to access the best care for all of our clients while giving loved ones and caregivers peace of mind, because caregivers as well are physically and emotionally and mentally affected by being a caregiver.
You know, many
Wow.
families, like you said, you come from a strong family. So do I, frankly, and I'm fortunate. And if you
We're the
have a
lucky
strong
ones, Otto.
family, that is a leg up, as far as advocacy goes, if you are not afraid to communicate. And to me, communication is the whole deal. And that goes on both sides. Doctors have to be willing to be communicated with and give you the time. And then you have to be not afraid to communicate on the other
Right.
side and think about the questions. Don't ask stupid questions, to be blunt about it.
Well, I will say, Otto, there is no stupid question when
You
that's
you're
what
in
know
I
a
was
what? You're
gonna.
patient,
right. You are
because
No,
absolutely
it's
right.
your life. It's your
It
life.
is. It is. And I think that that's, and this comes up a lot, Nicole, and this is why, we love having you on the show, because we're always, especially dealing with, the senior population. A lot of times, they might not want to, it's a generational thing. They'll come in and their doctor, has all the answers, right? So you're going to trust what they say. You're not going to, and like, listen, obviously they're not, malintent, but it is important to really prepare for yourself. And we always are saying, that's the key, is you go in, the questions that you want to hit. And this goes for any age. And, I always say this to Otto: I know about my own self when I've had a scary doctor appointment that I have to go to. It's You're in complete like fear. Your brain has 10,000 things going on. So it is so important to have someone there for you to, kind of take in the information too, because it's hard a lot of times to advocate for yourself when you're just completely in a state of nervousness and thinking about all these different things.
That's
I
absolutely true.
retract my statement, by the way, very strongly. That was really a stupid statement on my part. Uh, there really is no such thing as a stupid
Yeah.
question. You can't be afraid to ask a question.
Yes.
And I retract what I said.
There you go.
It's on the record, Otto. It's on the record. You
Yeah,
got
I was
It's all
wrong
right.
on that one. I hope it doesn't get out there,
You're good. Don't worry, my
to the
friend.
42 people who are listening to us.
Don't
Uh,
worry.
But
yeah,
it's true what you're saying. When people, and I'm a patient advocate. I know what I'm supposed to do. I know what to say. I know the questions to ask. But when it's me, I have my own patient advocate, because when we're in it, it's a very different experience. As you said, Kristina, you're foggy.
Yeah.
You're unclear as to what the next steps are. It's scary, it's emotional. All of these things play a factor in how we're thinking at the time. And the same thing can happen, Otto, to your point of having a big family and a strong family. The same thing can happen to the person who, is supposed to be there with you, right? So, as I said about a caregiver, the best of intentions, but some of us, when it's our person, whether that means your spouse or your best friend or your neighbor or what have you, when it's your person, it also can affect you, and
Yep.
that you don't see as clearly, and you would know if you were talking to somebody else, but this is your person. So sometimes that can be really difficult too. And again, as I said, I believe when something is happening that's a big transition, or you're scared about, or you're nervous about even, definitely have a patient advocate, whether that's a trained a patient advocate that's a family member, a loved one, that can really do it, because we all know that our times with our doctors are short, our clinicians are short. And so we do need to prepare. So something happens to me now, and I'm feeling off, but it goes away and then it comes back, and then it goes away and then it comes back. In 6 months, when my next doctor's appointment is, I may not remember that, right? So we have to keep a log, a book, a healthcare journal, which is actually a part of my book as well, so that we can keep track of those things, so that, again, we're making most efficient use of our time with our clinicians, because we won't remember it. Doesn't matter what your age, you're not going to remember it. So you have those questions with you so that you're prepared to ask them, whether you do it electronically in your phone, or you write it down on paper, or you have it in my book that you carry around. Either way, just have it there, ask those questions, and then be prepared to write down the answers, because that's another thing you won't remember, right? So how many of us, come home as patients, they had a doctor's appointment, it was maybe routine, or we thought it was going to be routine, but they needed a test. And then our loved ones say, "Whoa, what's the test for?" And we're like, "I'm not really sure, but I know it's on Tuesday and I can't eat for it." Like, we don't have all of the information. So ask those questions, make sure you understand the answers. I always say what I call a talk back. So repeat what you think you heard, because this is great for you as the patient, as well as for the clinician, because we all, no matter what our field of expertise or just our language that we use with our family and the silly little things that nobody else would get, or if it's our professional language, people forget that they're using it, right? Everybody's been at somebody who has a different career than they do, a different expertise, and they'll talk about something and they're so excited, and you're like, I have no idea what you're talking about, right? So the same thing can happen for a clinician, because they're speaking in their ease, and they're not realizing that you're not understanding. So you can say, "Okay, doctor, what I hear you saying is this." And so then you know that you actually understand it. Don't be afraid to repeat it. I am famous because even for my clients who I advocate for, it's not as important that I understand it as my client and their caregiver understands, right? And their loved ones understand, because it's not me. I can advocate all I want, but I'm not a clinician, and I'm here to make sure you know all of your options available, but I'm there to make sure you understand what your clinician is saying. So I'm perfectly okay saying, explain it to me like I'm 5, because this is important. It is your life. I had a situation one time, and I've told this a few times, but it happens often, where I had a gentleman that was my client, and he was in a hospital, and he was going through a whole lot of different things. But they had run some tests, and we wanted to see what was going on and what are our options. Was he going home? Was he going to be able to go to rehab? Was he going to be able to, what was our next steps, or what were our options for next steps? And when I spoke with the family, my client and his spouse, they didn't really understand what was going on. And so I said, okay, let me find the doctor in this hospital and see if we can't get to the bottom of what's going on, because you can't know your options if you don't know what's happening, right? So he came in and we had a conversation with him, and he said everything in medical ease, like so much so that, and I know a lot, but I'm not a clinician, but I was like, I don't quite even know what you're saying, and I don't have any problem saying so. He actually was a little bit, he seemed a little bit peeved when I was asking. I said, can you explain that to me? Because I don't understand what you're saying. Can you dummy down, if you will, your terminology? And what he said was, he has lung cancer. And they had not heard that at all. They were not aware of that diagnosis, because he was talking in a way that, and they were probably saying yes, yes, because we all do that when
Of
we
course.
can do that when we're hit with information.
Mhm.
And again, back to what Otto said, like thinking that they know all of the answers. And Kristina, you said,
Yeah.
it's called white coat syndrome, right? Like you just,
Mhm.
uh, and, um, and that it was unfortunate, of course, but I think that that taught the clinician, I'd like to think that that taught the clinician something, and it had us able to be able to understand what was going on and what our real choices were. So
Wow.
it's so very important to speak up.
You know, what I find is a valuable tool, you know, with knowing, like I'm a big believer, if at all doable, you get tests before you go to the doctor, not after. So when you go to the doctor, you can talk about the test. But one of the tools that I find very valuable is my chart. You know, in terms of in the New York area, and particularly our area, all of the hospitals around here and the doctors are pretty much involved with my chart, uh, which gives you an opportunity to look at test results before you go to a doctor, hopefully, and you're able to look and see all the terminology. You have no idea what they're talking about. Like you said, you know, there's very rarely like a one-liner that says
I
lung
know. I want to be like,
cancer,
just give me a
you know,
recap,
yeah,
all these
you know,
numbers.
it's like
Give me a
I
quick
want the
22
recap.
highlight reel.
pages, yeah, 22 pages of stuff. All right. So how do you boil that down so you understand it? That's one area. In other words, you can prepare by at least looking at the results, whether you're an advocate or a patient or whoever. And then the other one is I find you're actually able to communicate via email through my chart, and they actually do respond, which is a good thing.
Mhm.
So, you know, these are tools that didn't exist a long time ago, that or help the
Absolutely.
preparation and the planning.
Absolutely. And I'm really glad you say that, because that's one of the tools to be able to track your healthcare information. So I want to talk a little bit about that because I find it so important. And just so you're aware, just a year and a half ago, it made it so that the doctor's notes are in our portals, as that's what they are. And so that
Nicole,
gives
I'm
you
just
real
going to
access.
pause you there because we're going to pick this up in the next segment because we are approaching break. After break, we're going to continue talking with Nicole Christensen about keeping calm and getting a patient advocacy. And she's just fabulous. So that we'll be back and just discussing more and more about this great topic.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
Welcome back to Project Independence and You. I'm Kristina Liu, along with my co-host Otto Lohse, and we are talking about patient advocacy with Nicole Christensen, who is the president and founder of Care Answered and a friend of the show. So we were talking before the break about my chart and all these things, and I have to say, I love it. I think that's a great tool, but I also feel, and I'll share a personal story. My mom's been dealing with some cancer stuff for the past year now. So I go with her to every doctor appointment, and I sit there with my book and I write down everything that's being said, and trying not to get emotional, as you said, and I'm so glad you said, Nicole, because that is tough, right? She's my mom. I'm emotionally invested in all this stuff, but what was happening to us that we actually needed to kind of scale back from doing was, we were constantly checking the portal of, test results. And, so we're reading these things and we're trying to interpret, what these words are. And we're sitting there and it was just making us more anxious, and it was just because I was like, you're seeing these things, you're not going to meet with the doctor until 2 days, so it's like you're just getting yourself completely worked up. So we actually made a pact that when there's a major test, we're not going to try and play, General Hospital and figure this out.
That's a
So
really good point,
yeah.
because so these are called electronic portals. So they can have different names. My chart is one of them. So what I do want to say about them is they are very good. They have the doctor's notes in it. That was a policy that a lot of advocates worked really hard on. So it actually has the doctor's notes rather than just the information from a test. So when you've been there, although you still need to write down all of your questions, because we don't know if the doctor's notes will have all of that, and all of the answers, but it's really great because you can see and you can catch, because we're all human, mistakes. There have been many times that there's been a mistake within the portal. And so, like saying you have a diagnosis that nobody told you about. So you're like, wait, why does it say I have diabetes? I didn't know I had diabetes. What's happening? And then it could be just a mistake. And then you've caught it, because we know in theory, your electronic record could end up, God forbid something happens to you and you're in the ER and you're in the same, they're in the same portal and they think you have diabetes and you don't, and they're giving you something, it could lead to even more preventable medical errors. So for that as well, it's up to us as patients to check that out and see what's going on there. But I also used to say, have your questions for the clinician. Don't go home and Google it. You'll be, when you go and do that, you're dead already, because you've been looking up and you're interpreting
it's never good.
Yeah, you're interpreting it incorrectly. And Otto, being able to email these clinicians and ask them questions and not have to wait, because it used to be you'd have to call and call and call and call, right? Or you'd have to wait till your 3-month visit next time, or 6 months, or yearly. So now that closes that gap. Now the reality is every system can have a different portal, or if you have a specialty and it's not hospital based, they can have a different portal. And so we're still working, the United States, right, is still working on making sure that those portals talk to each other, because I've also seen that, right? I've had portals that didn't talk to each other. So we had the information. So you always have to have that information. You also want to look at it for your list of medications, right? You want to make sure, back as we spoke before about preparing for a doctor's visit, you should have all of your medications listed with your dosage, with what you think the diagnosis is that you're taking it for, when you take it, and including vitamins or supplements. You want to have all of that in, and every doctor, I know we have a clinician for each part of our body now, but for every clinician, you should have that list, even if that clinician prescribed those pills. We make mistakes, things don't get in there. We want to make sure we know exactly what's going on. So that portal is wonderful for all of those reasons. But if you're not, I really suggest everybody get on the portal and have their healthcare proxy on their portal as well. Healthcare proxy is somebody who can make your decisions, healthcare decisions for you in case you are incapacitated. Care Answered, we help that facilitate those discussions and get you a card, a laminated card with a QR code, so it can be scanned if you are hospitalized, or if you was, so that they can be contacted, and any changes also we can make so that it's in your portal and it's everywhere, so everybody's on the same page. But having that conversation with your healthcare proxy is just as important as having the paperwork and information that says you have a healthcare proxy, because
that's an important point, by the way, which I don't do, and I will do after this show.
Excellent.
See, there you go.
And the other one is like preparing for a visit. If you're not electronically capable, then hopefully you have a family member, friend, or advocate who can set you up, because otherwise you're going to sit in the lobby with 400 pounds of paper, filling in all the questions that they have, and setting up appointments in advance on a portal. It makes a huge difference. It's bad enough when you get there, but if you have to sit in the lobby and fill out all this stuff, and you don't have this card or this information or whatever, it makes a huge difference. So as an advocate, I would suspect that you do get involved with the portal.
Yes, if they wish us to, yes, we have actually a system in which we can make the portal easy to get to for our clients as well as their healthcare proxies. But it is difficult because you have a password for each one, and I
Sure.
understand it. But do understand, as a patient, you also have rights to your medical records. So you can ask, you can pay up to 75 cents a page, but you have access to those are your records. So you can request it and have it. So if you're a paper person, which there are people that are like, nope,
Mhm.
not doing that, then have it, because that information and you actually reviewing that information can save your life.
Wow. Now,
It's
Nicole,
a,
with Care Answer, like what would be the process? Like just like walk us through. We have an individual who, needs a patient advocate. Is there they would call a certain number? What's the exact process?
Okay, so thank you for asking. So one of the first things that you should know about Care Answered Patient Advocacy is that we focus our attention on transitions of care. So that
Okay.
means I need more care in the home, or I had a decline in health, or I had a recent diagnosis, or I'm in or out of a healthcare institution, or what are the ways that this care can be covered? I have a long-term care policy. I don't know how to get the benefit from it, or I think I know how, and then I got rejected. Um,
Mhm.
or I personally prefer if you call me before you submit the claim,
Right.
because I can do a
Right,
lot
right.
more work that way. Um, but or there's this thing I hear about called community Medicaid. How can I get that care in my home? Would I be appropriate for it? How do I advocate to get the care I need? All of those things, those are what we call transitions of care. And as unfortunately is the case, is it's those transition where the baton is dropped, right?
Mhm.
Any kind of transition of care, somebody thinks somebody else knows or somebody else is taking care of it. And that's where we really fall through the cracks. Um, so that's where we're really needed. In the case of preparing, which we do when I mentioned healthcare proxy, is hopefully you're totally fine, right?
Yeah.
And you're like, but life happens, right? It just does. So I want to get these things in order so that I have things addressed so things aren't a crisis, right? So there are crises that are going to happen, but at least we've laid the groundwork so we know what's in place and what to do next and who's involved, and we have our team secure. So that's so where I come is in the transition space as well as preparing for life as it goes.
Mhm.
And
um,
that brings to solo aging, right? That's the thing.
Mhm.
So all of these things that I'm talking about, we all have to prepare for. It doesn't matter if we're a solo ager. And a solo ager, it just means that there's not a traditional person that would be in charge of your caregiving if you needed assistance. So oftentimes that's folks with who are potentially not married, don't have any adult children, just don't have what we traditionally think as a caregiver. And there are some of us that don't think we're going to be solo agers, and then we become solo agers, right? Because something has happened to those that who would have thought would be our helpers or caregivers or partners in life. So I say that this for solo agers because it's particularly important, but it's important for all of us because we don't know what's going to happen or what somebody's capacity will be. Um, so this planning, so when we talk about the healthcare proxy that I mentioned before, there's also something that you work with elder law attorney with, which is the power of attorney to make financial decisions for you if you're incapacitated. Um, and there's also just knowing all of these things, right? You have your health book. You have maybe, so you don't have a healthcare proxy right now and you don't know somebody, but you're creating a group around yourself, right? And we saw this so vividly during the heart of COVID, right? This isolation, we're not meant for that, right? We're not meant, we are social people. And that isolation really affected many people's physical and mental health, especially older adults. And so what to learn from that, which was necessary, right? But it was still a tragedy on all sides, is that we need to surround ourselves with a community. We as people, human beings, I firmly believe, are in need of community. It keeps us healthier. People that have a community of friends, they live longer, and have better quality of health. So we know these things, and so we need to prepare. Doesn't matter how old you are. You could be 20 listening to this, 18, 16. It's the point is you always want to surround yourself with people that are of different ages, because they have different viewpoints, right? And you can have a fuller life, right? From coming to different points of view, from different points of view. And we all have our own skills and gifts, and we can share that with different people. So it is really important, especially if you think you're going to be a solo ager, but also I just think for life in general, to surround yourself with a community that you enjoy doing things with. And it could be different people you enjoy doing different things. That's totally fine and appropriate, but also different age groups, because again, even though somebody is married, and they've been married for a long time, and they expect that to be the case all the time. Oftentimes, they're the same age. So when a health crisis starts, there's no contract that says, okay, if you get sick, I won't get sick. And if there's nothing like that. So really surrounding yourself.
Does CAD answer like you're an advocate? Are there other Nicoles within your organization?
Are there other Nicoles? There's only one
Have
Nicole.
you cloned other Nicoles yet?
No, I am the primary advocate. I do have some people that are independent contractors that work with me at times, and there are other advocates around. Patient advocacy was really new as a concept when I started Care Answered, but it's grown because the need is great, and so there are a lot more people doing it. I was just saying, because I'm trying to launch a lot of different things, because I know what the need is and I want to get out there to as many people as possible, is that nobody Googled patient advocate when I started. Nobody did that. And now people do. So it's a lot more known. So there are other advocates, but yeah, I do most of the work myself. And I'm able to reach people at different stages. As I mentioned, those transitions of care, but then there are those folks that they want to just dip their toe in, right? They want to say, okay, I need somebody I'm in the middle of this. I'm a little bit overwhelmed. I just want to make sure I have everything together. And so then we do kind of a mini intake with them, and then they can do a subscription in which they can call once a month, and they'll have other things. And we're just launching those that are part of that subscription plan, setting up Zoom meetings for them so that they know, because a lot of the times caregivers, and that's who really reaches out to me. And so that's why it's so important, as you mentioned, Otto, with solo agers, we as patients or as people, and that we're going through stuff, oftentimes we're not the person that reaches out for help. It's somebody that cares for us that says, oh, you need help, and I can offer this kind of help, but I got to figure out somebody that can offer the rest of the kind of help. And so it's so important to know that patient advocates are out there, but they're also very lonely if you're a caregiver. It can feel very isolating, even though, as I quoted the late Rosalind Carter, most of us are in that situation. It feels isolating to be in that. And when you can meet with other people, even just briefly, because caregivers are the busiest people on the face of the earth, right? They're dealing with many, many things. Most people that are caregivers are still working, potentially caring for their adult children and their parents and that sandwich generation. So we're trying to bring people together because, again, for that community, as well as to know you're not alone. And there's lots of services out there and a lot of people that want to help you because they're going through the same thing and want a sounding board and somebody to have a cup of tea with.
Well, Project Independence, as you know, is sort of an advocate in many areas.
Yeah.
And you could be a supplement to what Project Independence can do. Project Independence does not go on doctor calls or go to hospitals or, to my knowledge, there's a line. I mean, these are nurses and social workers, and Kristina's got the control going. So
That's all right. You can finish that thought, Otto. But we will pick it up because I actually want to touch into the circle of support that we do at Project Independence as well. And it's a great match to Nicole. So after the break, we will continue talking about patient advocacy with Nicole Christensen, who is the president and founder of Care Answered. You're listening to Project Independence and you at LIU Public Radio.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Welcome back to Project Independence and You. I'm Kristina Liu, along with my co-host, Otto Lohse. We are talking about patient advocacy with the fabulous Nicole Christensen, who is the president and founder of Care Answered. So let's just jump right back in. I know Otto has a whole list of other questions he wanted to bring to the table.
No, well, one was strictly an editorial comment that this is a good match with Project Independence in terms of Project Independence will support people in many, many ways, but there's a line that they don't go past, which you can cross.
And you know what it is, and Otto, I could speak to, we get a lot of calls all the time from seniors and largely from their caregivers who, might not live with them, live in another state. I mean, there's so many children now that live in other states, and they'll call and say, my mom has to go to the doctor, and that they're not, they'll use the word aid, but they're not necessarily looking for an aid. They're really looking for someone to accompany, their mother and to help like break down whatever, is going on at the doctor. And I think it is so important. That's why I love this show and having guests on like Nicole, that we're able to, Nicole is part of our network in Care Answered, and our social workers and our nurses can, pass the baton, to Nicole. And I think it is such a service and so incredibly needed. We've had the Pull Center on a bunch of times too, and talking about these patient advocacies and just how important it is to prepare, and we were talking also during the break about this tool that we developed at Project Independence that it's a circle of support, because it really is important. And I was sitting here, Nicole, listening to you talking about, it takes a village, right? No matter what age you are. That's a saying for a reason. And having the circle of support tool, we always encourage people to fill out and look and see where your gaps are. Because, it might, I love when you were bringing that up because it's such a big thing, So, of course, you have to involve like, a lawyer a lot of times to get those kind of, elder law stuff in place and estate planning and all that kind of stuff. So it's definitely important. And I think the overall message with so many of the topics we discuss on the show is preparation, and really just thinking about it and all that.
Nicole, would you, like I reading your information before the show, my understanding is that you would get involved with somebody who's in the hospital. To me, that is the biggest area of complications, let's put it that way. Trying to figure out who's in charge. 5 doctors walk in and out of the room.
Right.
You get this test, that test, all these different tests. And I don't even know if that goes onto the portal right away. So here you are, you got all these people running around. You have no idea what's wrong with you or who you are the caregiver for. And I find that communication can be very, I've had the experience, not for me personally, locally, but for a lot of people. And it can be very frustrating to find who to talk to other than the nurse who may leak some information. It's to me, that's a very complicated area. And your thoughts on that one?
Yes, I agree. And that's part of the transitions of care that I was mentioning. So when you're in a hospital, or even when you go to a doctor's appointment, right, we're generally half naked in a robe, we're very vulnerable. And if we're in the hospital, even more so, because something's wrong with us. Like, we don't feel well, something is happening. And that in itself is traumatic. And then you have people running around and you don't know who does what. So what I suggest, again, is in preparation, as you mentioned, Kristina, it's having this information already. So when people call me sometimes, again, my book is From Crisis to Calm, but ideally people aren't calling me for the first time in crisis, right? Because I don't know what's going on with them, right? So if you, Otto, we had never met before, I'd never done an intake, and you were like, oh, I heard of this care answered, I'm going to call them, I'm in the hospital now, help me. There's very little I can do at that point besides take an intake of you right then and then advocate. So I'm behind the 8 ball, right? So what I suggest is, again, we can dip our toe and say, I want this information to happen. And then if I have a thing, I can give you a call and see what's up. And so then I'll have the information. So I'll be able to say, okay, this is somebody. I'll have a HIPAA form, because again, I can't talk to anybody without one's consent, without the patient's consent. And they can say, okay, Nicole, this is what's happening, right? And then your loved one can be a loved one, right? You're in the hospital. They want to make sure you're feeling good and that they're there for your emotional support and strength. And then I can go out and find out all the details of what's going on. And then I can communicate directly to them and say, this is the concerns. They have told me these concerns. You've told me the medications. A lot of these medications are unfamiliar. We need to make an appointment with the clinician, the hospitalist, even the head nurse sometimes is the person to speak with, because they have all the information in front of them. Again, everything is electronic. They might not have the details. They might have to have the doctor come in for the details, but they can at least tell you what's going on. It's been my experience. And there's not a thing people called nurses, right, in a hospital. So it has to be the correct nurse when I say that, maybe the head nurse for the floor. So getting all of that information together is vitally important. The other thing that I do as a patient advocate when one of my clients is in the hospital is to get in touch with their community doctor. So your community doctor, there's no alert, there's no bat signal that tells them that you're in the hospital necessarily, right? So we have all these electronic portals, but oftentimes they don't know that you're in the hospital. So I'll give you an example for one of my clients. So one of my clients, I was working as an advocate for her as she had a cancer diagnosis, and I was helping navigate through that for her. And then fortunately, she was in remission. We had everything done. She was doing really well. And then she got sick. And this is a person that wasn't on a subscription plan. So my work with her was pretty much done, because I make sure everything is there, and then I'm pretty much done unless you call me back. But because I had worked with her, the person, one of her loved ones, gave me a call and said, she's in the hospital. I'm like, for what? And they're like, I don't know. I don't understand. She can't speak. So I went to the hospital, and I was like, okay, I'll go to the hospital. So I had known it came that she had sepsis, which sepsis is another issue that people really should know a lot about, because it doesn't happen just in a hospital. And time is of the essence when you have sepsis. Very, very important. Anyway, so she had sepsis. We found out, we didn't know what was going on. She was able to talk and walk perfectly fine, and then she was down for the count. And so I had known, because I worked with her, that she had a shellfish allergy. I knew who her clinician was, so I contacted the clinician. I was able to say she has a shellfish allergy because they wanted to do an MRI with contrast, which would have killed her, right? So I was able to stop that. I was able to say, okay, these were her medications that she was on, and this is her history, that nobody else could say because she couldn't speak for herself, and she didn't have an appropriately prepared, although I did try very, very hard, healthcare proxy that knew all of this information. And that's why it's so important for your healthcare proxy to actually know your health information. So you have to trust them with that. So I was able to do that and give that information, contact her clinician, and therefore she was able to get the treatment because they had no information, right? Yeah. So we have all these portals, but that doesn't necessarily mean they're looked at. So they were treating her based on the issue she came in with, which she was completely out of it, right? Had a fever, she couldn't speak, she couldn't walk. So if somebody doesn't know, just like I had mentioned before, oh, if something's wrong in your chart and you have diabetes and you go and have something else, they think you have diabetes, but you never had it. Same kind of thing with negative information. They don't know what's going on, so they may treat you in a way that is counter to whatever prescriptions you are on at the time or medical information that they may not be aware of. So yes, I think the whole idea is to be a prepared patient. And that may mean having an advocate kind of actually knowing so that when these things happen, so that we have the information so that we can best help you. And then maybe you'll say, you know what? I've learned from you. I love those calls because another part of our mission is empowering all patients. Yeah. So when I get the call that said, you were in my ear and I was able to handle it, which is great. So if you're not sure and you're at that time of life where, anything could happen, which is all times of life, but you just want to have that security of having a board certified patient advocate that can help you if something happens, try it out that way. See if it's for you. I think for most people it is.
Now, suppose, of course, I know we're going to run short on time like we usually do.
I know we could talk forever, Otto.
Multiple things, all right? One, and you don't have to answer these right away, but one, how did I get in touch with you? Two, right. What would the process be when they get in touch with you? And then three, this is not a charity. We have to be honest about that. It's a private pay world for the most part. And you mentioned something about a subscription. How would that all fill in terms of the subscription and a kind of an overview of how cost is determined? I know that's a lot, but
it is. But let me try to get to it. Okay. Right. So, one is that I am the author of the book From Crisis to Calm. So if you have questions, and again, empowering all patients, I suggest you get the book because it has a lot of information in there that you may be like, okay, cool. I can do this. Or, okay, that's a lot. I'm going to call a board certified patient advocate, or somewhere in the middle. So you can find that my book, it was a best-selling book wherever books are sold. Okay. So that's one thing.
So that name of that book is From Crisis
to Calm.
Right. And I know I looked it up, frankly. I know it's on Amazon and Barnes and Noble and a lot of other websites. And you could probably physically go somewhere, but it'd be better, I think, if you tried to order it online.
Whatever works for you.
Yeah, whatever your mode is.
Individuals.
Okay.
Yeah.
So that gives you education.
So that's one thing. Then the other is it depends. I try to do like a flat fee because I don't prefer to charge by the hour. Honestly, it's annoying for everybody involved. But so it's different fees for different things. So, but an intake can cost from an intake consultation can cost anywhere from $350 to $850, depending on what it is. But the initial consultation, so like a 15-minute call to say, hey, I want to see if you can help me, that's free. So you can always give me a call at 516-584-2007, extension 1. Okay. Or you can email me at Nicole, Nicole, at careanswered.com. So that's CARE, answered, ANSWERED.com. You can also find us on social media if you do LinkedIn or Facebook or Instagram. So you can get in contact with me and we can schedule a quick consult and see if we're a good fit for you. And I come from the world, before I started Care Answered, I really came from the world of social service nonprofit. So if you are lacking funds and you're saying, there's no way, then potentially I can always refer you to services that might be appropriate for you, whether they cost or not. But I will do my best to find services that can assist you, that might be free of charge or available to you. I've referred to Project Independence more than once. And what was your other question? Did I miss something?
About the subscription, like, that
Oh,
was
yeah. So the
intake.
intake is always part of it. And so the
Okay.
subscription, it depends on what level of subscription you get. So it's, it could be 3 months, 6 months, a year. You can get, it's like many packages, like you have the basic package and then you have the deluxe package. It depends on what it is. And then there are people that are actually in that transition of care. And so then they're trying to get a safe and appropriate discharge from a hospital or from a rehab, or they're trying to, so that would be a flat fee depending on what's going on. And then also a flat fee for things like community Medicaid advocacy, a flat fee for any kind of, what am I trying to say? Appeals for insurance or that kind of thing. So it really depends, but it definitely costs. But I'm very upfront about my costs when I talk with people, so that they have an understanding, even in that 15-minute consultation. And it will be on my website very soon, the costs.
Awesome. And I have to mention, your website has a lot of great resources too. There's such wonderful articles. When I was putting together material for this segment, I mean, there were so many different really great articles and tools, and we always love to use the word golden nugget. So there was a lot of golden nuggets certainly on there, and tips. And I just want to remind people that if you are listening to this interview, you could always watch Project Independence and You and Talk of the Town on North Hempstead TV, Channel 18 or 65 on Optimum, or Channel 46 on Verizon Fios, and it will also be on North Shore TV. You could always visit www.myNHTV.com for up-to-date schedules. You could also watch us on the WCWP YouTube page as well.
Now, Nicole had a blog,
yeah.
and in the blog, I saw something about, I have a lot of reasons to know this, an Alzheimer's drug. And you wrote this article back in August, and I was just curious as to whether you've had any exposure.
Unfortunately, Otto, we're gonna have to have Nicole back for that.
You're gonna have to bring me back.
Because we are.
But I will say that there is, we do webinars monthly. So there's a webinar on February 14th, Valentine's Day, about caregiving and dementia. So that'll be a great one.
Well, thank you so much, Nicole. We've been talking with Nicole Christensen about all things patient advocacy. She is the president and founder of Care Answered. And thank you again, Nicole. We will have to have you back.